I apologize in advance for my voice being hoarse, but I've been shouting cadences at the academy all week long, and that's really got my vocal cords pretty tore up because I haven't learned how to do that in a skillful way yet. Okay, so in this video, I'm going to be discussing, or I'm going to show you how palpation leads to, excuse me while I get a cough drop, how palpation helps me to decide where I'm going to put the needles, how I treat somebody, what the problem might be. And I'm also going to discuss, that's my dog shaking in the back. This is like a real lo-fi, low-key video. I have to do it this way for a while. I'm also going to discuss some of the things that are unique or beneficial when you work with someone for a long period of time and that person starts to understand your body pretty deeply. And also I'm going to kind of zoom out and try to touch on the nature of my practice and how that often has a little bit more to do with my relationship with the person and understanding the person's mental and emotional history, mental and emotional health, spiritual health, and how I try to use all that together in order to help someone. So what this patient who I've worked with for, I don't know, like 15 to 20 years is showing me is where they have the pain. And what I'm doing is I'm putting my fingers between the vertebrae so that I can feel how much space is between them. And then I'm marking them with my fingers, like 2, 3 at a time, so I can measure how big the vertebrae are and like where the bony landmarks are. Like like T7 should be right in line with this bony landmark. L2 should be in line with that bony landmark. C7, etc. Right? So I'm just kind of getting like surveying the spine and trying to form a clear picture of this person's body. And that starts with the spine. Okay, now what I'm doing is I'm getting a clear picture of the muscles. So by strumming across the musculature, the spinal erectors, I can feel, is there a difference on the left compared to the right? Is there like anything remarkable? Like, do I feel water or swelling under the skin? Is the temperature the same on both sides? Is one side a little warmer? Does one side feel like it's like inactive, like kind of smaller, softer, not being used? Is one side more tense? And this whole time, I'm asking my client, my friend here, for feedback. So what do you feel there? Does that feel remarkable? Does that feel like it might be something? Okay, yes, so what does it feel like? What is the sensation you're feeling? Are you having pain or tension, or what do you have there? And then how does one side compare to the other side? Do you feel a difference on the right compared to the left? Like, for example, here I'm feeling the quadratus lumborum muscle, the muscles that are a little further out from the center of the spine. And in a minute, I should be going over to the other side. So, yeah. So now I'm feeling the other side, but with my thumb, the same muscle, and asking them, is there a difference in the sensation when I press on the right versus when I press on the left? And that all gives me a clue as to what's happening, not just to what it feels like when I press, but if somebody has pain, like what might be causing that pain. If the muscles are more relaxed or inactive on one side, or thinner on one side, or tighter on one side, or bigger, thicker on one side, then my next step is to ask why. Why are the muscles asymmetrical? Why are they firing asymmetrical? Why are they shaped asymmetrically? And what effect might that be having on the area of pain? So I start to draw a map in the body, and then I fill in the picture with specifics that are either remarkable sensations to the client, or which are kind of remarkable sensations under the finger that feel remarkable to me. All right, so once I have a picture of what I think might be wrong, then I move on to the treatment. Oh, and I almost always, when I'm dealing with the back, I almost always go on to check the muscles between the shoulder blades, which are inevitably tight. I call these the usual suspects. I always check muscles which are the usual suspects, even if the person is not having pain there. So here I'm checking the muscles and the ligaments that can be felt right next to the spine, at the base of the spine between L4, L5, L5, S1, and trying to get an idea. And here I'm just taking my final sweep, just getting an idea of like forming a final like quick snapshot of what the person's body feels like. So if you do that several times a year for like 2 years, 3 years, 4 years, you can feel when people's bodies are changing. Like this client, this friend of mine, I don't actually have clients and patients. I have I have relationships with people, relationships with friends, and this person, I know when he's been swimming, and I know when they have not been swimming, they've been working too much, stressed, when they're sleeping on a different surface, all that kind of stuff becomes pretty clear. I know when something's going on that's more posture related versus more exercise related versus more stress related. And as you get to know somebody, as I get to know this person and work with them, the pictures that I form in my mind are not just physical, they're also emotional, mental, spiritual. Okay, so what you're seeing here are cups, and the cups are placed in, let me show you, the area where I think the main pain is located. Actually, I think I start pointing to it with my finger. Yeah, so this is the area where they're having most of the pain, and this is a secondary area which was not painful but was kind of painful or tight when I pressed on it. And it's those top three and those bottom two that are right in the area where the person is having the pain. All right, now the other cups, like this cup here that I'm pointing at, that's an area where you have muscles that are really important to loosen and treat. That's the the lower trapezius muscle and some of the rhomboids. We all know that annoying mid-back pain. But you know, if someone comes in and they're saying, I have pain right here, your acupuncturist or massage therapist or chiropractor would only know that this muscle is problematic, tight, having trigger points, habituated to some kind of movement pattern that's, you know, asymmetrical or dysfunctional, if they start palpating. So, you know, palpation is that important. It gives you small pieces of the picture, and it gives you like the big pieces of the picture. And with all that information, I'm able to form a treatment plan. So the treatment plan for this person is to loosen the muscles and the fascia adjacent to the areas or in the areas where they're having the pain, as well as the ones which were tight and uncomfortable when I was palpating them, right? Which caused pain when I was pressing. And then also some of the usual suspects, the base of the spine, the middle of the back is less important, but you know, this is all one straight line from the bottom of the spine, from the thoracolumbar spinal erectors at the base all the way up to the top. It's all basically one, not straight line, but one series of arced curves, and they kind of summate as, you know, the low back muscles. Anyway, getting a little off topic. Couple places that are problematic, like the lower trapezius muscle on each side, and then another usual suspect, the upper trapezius. Almost everybody has some kind of pain or some kind of problem there. By the way, I'm making these videos like this because I realize how important it is to me to stay active as an acupuncturist, to like keep my mind working, and this is a great way to do that. Acupuncture has lately become a grounding force for me. It gets me down into my body almost immediately, because I have to be really grounded to pay attention and to palpate and treat someone and to be there holding space for someone. I have to be really grounded. And this is a point in my studies to be an EMT when that groundedness is becoming really crucial and really challenging for me to maintain. So I appreciate acupuncture and the experience that people bring to my experience of doing acupuncture even more. Okay, so moving right along. Now, I've started to insert needles in the muscles adjacent to the spine, right? The spinal erectors I was talking about. If you just follow the cup marks, those are the spinal erectors. And I thought it would be beneficial to needle these muscles to encourage them to loosen. This is not where the patient is having, where my friend is having most of the pain. Most of the pain is right here. So here's the spine, and then these are the muscles and the joints right next to the spine, and then a little further out is the fattest part of the muscle belly of the spinal erectors. So it's the spine, and then the joints and the thinnest muscles next to the spine, and then the thickest muscles next to the spine that we think of as the back muscles proper. Let me drink some water. Man, losing your voice is just a bitch. All right, so up here, what I'm thinking about, as you can see, the needles, like this one's going right into the purple mark. That one's going right into the purple mark. What I'm thinking up here is to loosen the big muscles, because there's no specific pain pattern up here that we're trying to affect. I'm thinking about the connection of the muscles down into the problematic area. So it might be beneficial to needle closer to the spine into the joints here, but it also might not be. And I usually take this approach where I needle the muscles above and below, and then as I get to the problematic area, I'm going to actually needle these joints here. Now my fingers are right on the spine there, right? They're right on the posterior, what's it called? Posterior process of the vertebrae or whatever. And I don't usually needle into those joints. Usually I'll needle right on the side. Remember I said that here's the spine in the middle, and then there's the joints on the side and the thinnest muscles on the side, these small muscles that connect vertebrae to vertebrae. And then a little further out, you have the big muscle bellies that connect large sections of the spine above to the large sections of the spine below, right? And so what I'm going to do is I'm going to put needles just laterally, just to the side of the spine, into the joints, so that I can loosen the vertebrae that way. Let's see if there's a video of that later. Okay, so let's go to the next one. Oh, this looks like it's just so I'm palpating again. Now this time, instead of palpating, wait, you can see I'm palpating the spine there. That's right in the middle, and then I move slightly over so that I can get an idea of what the joints are like right next to the spine. Right, so I'm feeling those joints next to the spine where I'm going to needle. So that's the most painful place. So I want to loosen the vertebrae, loosen the joint spaces as much as possible. That's why I'm needling there. And I might needle the muscle bellies, but I didn't do that today in that area. I did that above and below. And then lastly, I'm going to feel the muscle bellies. So I slide my finger a little further out, and there I start to feel the muscle bellies. So now I have a picture in my head about what the spine looks like, what the joints, the lateral aspects of the joints are like, and what the muscle bellies are like. Okay, and then here is the finished treatment. So let's see if we can contrast the difference between the upper and lower needling. Okay, so the upper needling you can see is right in the muscle bellies, right? It's like right in the dark cup marks. But the joints lower down, the needles lower down are actually in the joints. Right? They're not so much in the cup marks. They're really close to the side of the spine. So look at these needles up here. Here's the spine right in the center, right? See if you can visualize how far away those needles are from the center of the spine. How far this one is. These are right next. These are the same segment. so the same like longitude or whatever, or latitude. And then if you follow the spine down until you get to like here, see if you can visualize how much closer to the spine these two needles are compared to these two needles up here. This space, distance, should impress you as being a lot bigger than this one, because these needles are in the muscles, the big muscles, and these needles are in the joint space, the small ones on either side of the spine. My thinking is that if I can loosen the joint spaces, loosen the vertebrae, and help them move more easily, the muscles on the sides will relax. I'm also thinking if I needle into the joint space, it'll force the circulation to open the joint spaces, decompressing in effect the joints, because when blood rushes into the joint spaces as a result of the presence of an acupuncture needle, it presses the vertebrae apart, or it helps to flush out the swelling and loosen things as a result of there being more healthy fluid inside, kind of like a pneumatic pump. All right, so now another important aspect is that I apply microstimulation, and the microstim, the reason I like the microstim is because microstim increases the amount of energy that the cells produce. It increases the amount of ATP that the mitochondria produce. So if I put muscles in either side of the spine into those joint spaces, and then I run microampere microstim through there, it should help the body to reduce inflammation and repair whatever needs to be repaired in there at a much higher rate. And it does seem to play out that way. People do get really, really good results from this approach. And in fact, the patient, my guy later said to me, he said, let's see. He said, "Thank you so much. I feel great." Yeah. Okay. I guess that's all he actually said. But I thought he had written some like big long thing. We actually had like a little discussion after that, but not to do with his pain. So, and then I needle the upper trapezius muscles, just because those are tight on so many people. Almost everyone can benefit from those. And this individual has significant amount of stress. So I also add really effective stress points to release endorphins. So a needle in the outside of the ear, a needle at the top of the head. All right, and for those of you acupuncturists, I know you're out there. Welcome. I acknowledge you and thank you for being here, for being curious about how I do things. I appreciate it. Now, I just want to show you like the frequencies and everything that I use. So I use a Pantheon Research. I always use like 6 to 10 channels. I have 2 machines, one 6 and one 4. Together that makes 10. And my preference is almost always to use microstem. And I use one slower frequency around 1, I think, hertz per minute, or I don't know how these are measured actually, but I set the frequency as 1, we'll just say hertz, and then the other frequency is set at 100 hertz. So the result is that there's a mixed or an alternating kind of stimulation, a mixed stimulation. So there's bop, bop for the slow. There's the slow frequency, and then there's a fast frequency that looks almost like a continuous charge being administered. But it's actually a really fast frequency, like a rapid fire, like brrrr, that's what it feels like. And the reason I do that is because I find that this is based on one of the theories of microstim, and I find that this does help. The theory is that if you use a low frequency, the low frequency contacts, let me see if I can get this right, contacts the deeper structures like the bones and the joint capsules and the tendons and ligaments. And the higher frequencies they stimulate the mitochondria in the shallower structures, so the muscles, the fascia, and the skin, and even the blood. All right, and what's really remarkable about this, what's really unique about my work with this patient being a good example, is that you start to notice things, and when you point those things out to people, it's information that they can then run with. Like for example, um, the muscles that are a little bit smaller or thinner on one side of his low back than on the other side. Remember, I said that the ones over here were a little bit less developed than the ones on the other side. Well, it's an important thing to notice. Like, why are the muscles in your low back asymmetrical like that? And it is my job, or at least I want it to be my job, to give people that level of information, so that they can then think about how they're using their bodies when they swim or when they're working or performing tasks, and to then give thought to how they might be able to change those things. Sometimes you find structures that are atrophied or small that you just can't do anything about, but a lot of times some change can be made simply by looking for asymmetries in how we move or patterns of accommodation, or adding exercises or adding movement types that we haven't. So if I see that someone has thinner muscles, smaller muscles, less active muscles on one side, what I probably would recommend is that they start to use the muscles in that area, both left and right, moving symmetrically, in a way that can wake them up. That might look like a plank, or it might look like upward facing dog or cobra, or it could look like Supermans or fire hydrants, also called dirty dogs. And those exercises will start to wake that area up, and that'll give you more information once you understand. Once you connect with your body and you can feel the connections, you can feel the muscles firing. A lot of times you can then start to feel when the muscles are not firing or are firing asymmetrically. Sometimes it feels like you have access to your muscles, and sometimes it feels like you can't access your muscles. No matter how hard you try to get them to turn on and fire, you can't do it. Well, that kind of information can save you a lot of pain and a lot of trouble down the line, because if patterns are left to just run their course, usually it leads to some pretty nasty things, like muscles that are not active, that can't do their job. They don't keep the joints separated very well. The joints tend to start to collapse and rub against each other, and that can lead to things like joint wear and tear, arthritis, cartilage breakdown, etc. So this is a pretty important aspect of working with someone for a long period of time. And this is why I always say that really I don't want clients, I don't want patients. I don't want to fix a problem and move on. I want relationships with people so that I can understand their bodies, and look out for them a little bit more fully. And it's a lot more satisfying to me. I mean, I need my work to be satisfying and to feel like I'm helping people as fully as I can. So that's a big part of why I take this approach. And the other part is just because I think it's interesting, academically. So I'm helping people, I'm having a more satisfying experience at work, and, doing things or using concepts that I think are kind of interesting. All right. I know I tend to ramble along, but you're stuck with me, unless you bailed in the first 30 seconds like most people. But I hope you found this helpful, interesting, and if you're a body worker, start palpating, get in there and start visualizing the body. And if you're a patient, if your acupuncturist doesn't go through a process that seems like pretty, thorough palpation, then look around, shop around, try some other people, see what those what those other providers have to offer and how the benefits might be different. All right, take care. Bye-bye.